Today I'm here at HIMSS 2026 at Las Vegas, Nevada, and it is my pleasure to have with me Dr. VK Gadi from University of Illinois Health Systems. Hi, Dr. Gadi. How are you doing today?
Doing great. Hi, Pinaki. Thanks for having me.
Absolutely my pleasure. It has been a pretty busy day, and we're seeing a lot of things happening. And this is the AI Pavilion, so there's a lot of people walking up here asking us what we do and how we are proposing to bring the whole AI systems into the hospital systems and the care platforms, right? In today's world, how fast AI is moving into workflows in private sector and government sector. In healthcare systems specifically, what are you seeing the challenges where there is significant friction or some problems for the AI system to move into the healthcare system? What are the problems you're facing?
Yeah, there's obviously many needs that you could try to tackle, and trying to boil the ocean is probably not the right way to start this. But even with humans in the loop, there's so many places where we're still not getting the job done. And what I would appreciate is ideas to solve those spaces. There's plenty of them because we've got nothing, even with humans in the loop, that's not fixing them. And then certainly if they can make the lives of the humans in the loop better, all the better, right? So that's kind of where I'm focused on, where I can see helping people that I work with.
Now, from a standpoint of every day when you're delivering care, the patient walks in, taking their information, you're putting the data into the EMR, and then you're kind of pulling the data to make decisions and all that system. Which areas you feel that AI can really contribute to exponentially change the whole order of magnitude?
Can I just say yes?
No, you can say whatever you want to, but what
literally everything you said. So I'm an oncologist, right? My job is some of the most complex medical care that can be delivered. I trained 6 years just to get to that point. And it's about the most training you can do in medicine to provide care. And then on top of that, it became even more hyper specialized as a breast cancer doctor. The medicines are insanely expensive. The patients are very sick in many cases. The care requires coordination between multiple types of providers. It's not just me by myself. I work with the surgeon, the radiologist, the radiation therapist. We have to coordinate all that care for the best outcome. We also have data showing when we don't coordinate that care, patients will die. Patients will do better. So the stakes are incredibly high for us to get it right every time. And, in that pressure situation, you can see so many inefficiencies and we can't skip over them. I have to deal with each one of them. And so I can walk you through an example. Let's say I have a patient who comes in with a new diagnosis. Right out of the gate, I need an MRI of the breast. I might need whole body scans. I might need specific tests on the pathology. And I have to remember that those things are needed. But having an agentic device saying, did you get that? Oh, you didn't get that, but maybe you should, but you still need to do this other thing first before the insurance will clear that. And then every one of those things I just named, an insurance company is looking to deny that out of hand. And so what can I preemptively do as I'm preparing my documentation so that that does not happen? Once we get past that, even I do everything right, sometimes the reviewer at the insurance company is going to say, oh, wait a minute. I need a fast way to appeal that, right? Each one of those becomes a phone call in my world where I'm calling somebody. But if I was able to preempt that ahead of time, it saves me money. It saves the insurance company money. They're not enjoying having to hire a physician reviewer to look over my case. So, and I can walk through the entire spectrum of activities, even at the very end, when I'm finally able to give a drug. My drug costs $13,000, $14,000 a dose. You know that there are people reviewing everything to make sure that that's an okay decision on my part. The stakes are very high. So you pick your point. When I said yes, I was joking, but the truth is every one of those decision points could be facilitated with agentic solutions.
Wonderful. Yes, AI is great, and I'm an AI developer, so I understand that we want AI to be everywhere, but there are certain areas where we need some governance from an ethical standpoint, from data sharing standpoint. What's your 2 cents in there? Like what the governance will come in?
Yeah, so I think, health systems want to own the data. Insurance companies want to own the data. Everybody wants a piece of this because when you learn the patterns that are going on in the data, you can create efficiencies. You can also monetize those efficiencies. But who really owns the data is the patient, right? And so how do we harmonize what we're doing, acknowledging what the patient's contribution was to this, right? How do we make sure that the dollars come back and support their care for their sacrifice? Right now, it's so fragmented, we can't pull it all together. But if you have AI kind of facilitating those exchanges, you can see how everybody gains from this. And then you can create real data that's harmonized, that's tractable, that you can kind of extract what information you need from. And this is one of the biggest headaches I have as a physician scientist, right?
Right.
It's very lofty goals,
Yeah.
but if you have to start somewhere, and I think,
Right.
you know, what you guys are doing is heading down those paths.
No, thank you so much for your perspective. Appreciate it. And we'll stay in touch and learn from you as we
Absolutely.
progress with this.
Yeah.
Thank you once again.
Yeah, thanks for having me, man.
Yeah.
All right.